paradox because the government isn't willing to fund people who are being victims of sexual abuse or domestic abuse or violence. Do we think it's because there's such a massive number of people in Australia that have actually subject to violence in the home? So if you look at the Australian Bureau of Statistics, 2 in every 5 Australian adults have actually been the victims of physical or sexual violence. And in the Australian Institute of Health and Welfare, we often talk a lot about domestic violence in the context of relationship, between a man and a woman. But oftentimes, so around 7% of adults who are experiencing violence, it's coming from another family member. So I know that's an adult population. That's about 1.4 million Australians. That doesn't consider, adolescents or children. But do you think it's such a big problem that the government isn't willing to fund it, despite it being, such a burden for people like yourself now who went through that post-traumatic stress, but then feeling like you are not able to seek help or gain that help and support that you need, despite seeing all those advertisements on the back of buses from Mission Australia saying, if you're struggling or you're without a home, seek help, reach out. So I find it's quite contradiction, really.
Yeah, wow. Yeah, I could get controversial. Am I allowed to be controversial?
Go for it.
Okay, I think this is what I think about the government. We could be here all day. I think the government in the not-for-profit space or anything around social issues are very good at putting their funding at the front end of the problem. So if we're to drill down on the issue of domestic violence, it's a great announcement to be able to say we've opened 600 refuges, or we've cancelled this many women, for post-traumatic stress, blah, blah, blah. Everything's up here. For me, the funding needs to come back here where it's not visible, where it's not going to get votes. But again, if we're doing things for the right reason, then that generational change needs to happen. And it's education, it's early intervention, it's education, it's, all of the things that we put back here that's got, the funding or as much funding, but as much funding up front of the problem. And so my answer to you would be it's not going to get votes. It doesn't get votes, and then the government will throw in distractions like, The Voice at the moment, which I won't get into, but I think, it's like there's no other issue that exists in Australia at the moment, and we just yesterday went to the media with a media release on statistics that we've just launched around hygiene poverty, and it's now 1 in 3 Australians, which is a significant crisis. I'm not using that word loosely, that is a crisis, and they don't want to know about it because, let's put our funding and all our energy and effort into dividing the country over voting around The Voice. And, so everything is just smoke and mirrors and, distraction. But for me, if I was in government, I would be looking much more at how do we stop people jumping into the river rather than dragging them out after they've drowned. I just think, and that isn't a change that will happen overnight or a fix that happens quickly either. It has to happen over a generation. That's what people don't realise. But for me, the funding is at the wrong end. So
prevention instead of curation and treatment.
Prevention is better than cure. That's the smartest thing that anybody ever said to me when I was about 16, and actually it was related to skincare, but I worked out through my life how relevant that statement is in so many aspects of life. Is prevention is better than cure. Let's get to kids, let's get to youth, and that's the real foundation of our schools hygiene support program. So we supply 300 schools in lower socioeconomic areas to access personal hygiene products, and that's the real foundation of that, is getting to kids by the age between the ages of 5 and 10. So that's when that developmental stuff around self-worth happens. And if you miss that, then the whole trajectory of your life changes, because you're making decisions based on the fact that you haven't grown that self-worth. And so that's again that whole put the money back here, not up here concept is very much at the center of our thinking.
Absolutely. And I think the saying is an ounce of prevention is worth a pound of cure. It's
Love that.
really strong, isn't it? Really
Isn't
strong
it? So
message.
strong. And it applies to so much. Yes, not just skincare.
And the government. But anyway,
Yeah.
we'll leave that for now.
Yeah.
The hygiene poverty in Australia, as you said, about 1 in every 3 people. It's a huge, huge problem, as you said. Why in Australia, well-developed country, are we having such problems, and what are the barriers to everyone receiving the health care that they need and the availability of these hygiene products and toiletries?
Well, there's a cost of living crisis, as you know. So when you're, for example, you have $100 left to feed your family, the very first thing that goes out of your supermarket trolley is anything in the space of personal hygiene. So you're filling up on your mince and your rice and your baked beans and God knows what else, because your job as a provider, as a parent, as a family, is to make sure your children go to bed with full bellies, right?
Yep.
But I think now with some of the research we've been doing, we're just starting to actually uncover just how significant the long-term issues are of not being able to brush your teeth, head lice, not being able to wash your hair, the bullying, the mental health issues that come from it. So yeah, around your question, it's a cost of living crisis. I think there's a real taboo around what men might need in that space. We talk so heavily about what women need in period poverty, which is, certainly a significant issue, but a small part of a much bigger pie that needs to be discussed. And that bigger pie includes what men need as well, and what they need to be able to pull out of their bathroom cupboards to confidently connect and communicate and contribute to their world as well. So really busting open some of those conversations and, saying to guys, it's okay for you to say what you need as well. If you look at our statistics at the end of the year, we actually help just over 50% men and just under 50% women. So it is much more men than what people would think. And we need to talk about that. It's discussion that's going to fix it.
Yeah, I think people actually don't quite understand the extent to which like oral health can actually affect. It's so linked to every other, I guess, bodily system. So like if you have poor dental health, it has massive implications for your cardiovascular risk, periodontal disease, for instance, as we talked about. If you can't afford to pay for dental supplies, toothbrush, toothpaste, floss, mouthwash, obviously we need to eat, and that's the biggest thing in the short term. If you don't eat for weeks on end, you're going to die, obviously. So in the short term, that's the biggest need. But periodontal disease, for instance, is a much more insidious long-term disease. As we were just talking about prevention versus cure, obviously we need to help Australians get access to more of these supplies and healthcare. So how is Pinchapoo getting this out to Australians?
I guess just to your point on that, just in the space of dental, there's so much data that we've been working on with a fantastic research group called Per Capita over the last 6 months that suggests that so many of those interim things we put into place while we can't afford personal hygiene products or can't access them have really significant, as you said, really significant long-term effects on your health. We have people, using, one lady was using dishwashing liquid to wash her hair, and she now has a scalp, like a dermalogic issue with her scalp, which will be a lifelong thing. So, that's just one example of millions, but it's really important to realize that it's not just washing your hair and feeling good and being happy and moving on with your day. It's actually really a very significant long-term issue that becomes exactly that, an issue. So what Pinchapoo are doing, to your point, Hayden, is tackling it again from a youth perspective, so trying to create the generational change. So we went back to the drawing board 7-8 years ago now and said, we are doing a great job of helping people in the system. We're doing a really good job. We're supporting all the big guys. We're pumping out millions of products a year. We're doing a good job, but we're not getting to all of those people falling through the cracks. You know, all of those people that we can't possibly know every person in every family in every community around Australia. You just can't. So we started to look at platforms on which we could lean on to execute those programs, and schools, you know, came up as a really, really powerful one, because in every school now, there's a school doctor, there's a school nurse, there's a welfare coordinator, or there's a chaplain, or there's someone who is aware of those students and families who are doing it tough, whether it be a temporary situation, whether it's a, you know, a long-term situation of disadvantage, whatever it might be. So leaning on those amazing people who support their local communities and are aware of those needs has become a really powerful tool. So we launched our school's hygiene support program that now looks after 300 schools. Which sounds amazing, but we also have a waiting list, a genuine name and phone number waiting list of over 360,000 children.
Wow.
Waiting to access that. So, you know, it's about nearly 1,200 schools who are on a waiting list because the government won't listen about funding, regardless of the data that's been provided to them. So, so again, we could go off on a political tangent, but to answer your question, that's how we're going to tackle it. We're going to tackle it leaning on those amazing platforms of people who are aware and connected and engaged with their local communities and can help us reach those people who are not under the care of an organisation, but just doing it really tough.
So currently you're supplying 240 schools?
It's actually nearly 300 now. 240 is an old stat. Yeah. We're sort of trying really hard to say no, but it's just impossible. So yeah, it's everyone has terrible stories when they come to us, and it's really hard to say no. How do you say you can have access and you can't, and pick and choose? So you know, these are the things that people need to be aware of. There's, you know, 364,000 children on a waiting list to access a bottle of shampoo and some, you know, a toothbrush and toothpaste. It's just an astonishing thing to not be talking about.